Good evening, everyone. Now it's time for our international webinar, and today is the 1782nd day of uninterrupted daily webinar of International Forum for Promoting Homeopathy. And today's our guest is Dr. Veena, who is consultant homeopathic physician from Hyderabad, and she has more than 10 years of clinical experiences. And today's our topic is about integrative medicine, the new norm. So let's welcome Dr. Veena ma'am, and let's hear her valuable insights. Over to you, ma'am.
Yeah, a very good evening to you all. Namaste. I am very privileged to be the part of IFPH and yet again an opportunity given by IFPH. I'm very thankful to them. Am I audible and clear?
Doctor, please adjust your cam. Please adjust your camera a little more. Okay.
Shall I share my screen?
Yes, yes. Please adjust little more. Your only half of your face is. Yeah. Okay, now it's okay.
So, today our topic is integrative medicine, the new norm. So why I have taken this topic is so I had few experiences which I would like to share with the forum, so that I can even get your experiences on the same, and let us try to do it together. This is the month of July, and July 2nd, 1843 was the memorial day of Dr. Samuel Hahnemann. He left the earth and attained the heavenly abode on July 2nd. So we are in the month of July. So I would like to give this session a tribute to our great master, Dr. Samuel Hahnemann, on his 179th memorial year. I would like to just have a prayer which was written by Subramanya Bharatiyar, who is a patriotic and a poet from Tamil Nadu. And he was a rationalist. So this is in Tamil. Please bear with me, but it is very close to my heart. So I wanted to present these lines to the forum. So this says like நமக்கு தொழில் கவிதை நாட்டிற்குழைத்தல் இமைப்பொழுதும் சோராதிருத்தல் உமைக்கினிமை இனிய மைந்தன் கணநாதன் நங்குடியை வாழ்விப்பான் சிந்தையே இம்மூன்றும் செய். Meaning, my duty is to work or perform the duty for which I have been born. That is poetry for him. For us, it is homeopathy. And do the work for the betterment of the nation. And not even a single minute you be lazy. We are not allowed to be lazy. So I just keep my mind or keep telling my mind that I want to be doing my duties or the work perfectly for the betterment of the nation or for the betterment of humanity, and never be lazy at all. So no indolence. So this is the first answer. Meaning this is a big poetry, but I have taken intercepts from them. பக்தி உடையார் காரியத்திற்பதரார் மிகுந்தம் பொறுமையுடன் வித்து முளைக்கும் தன்மை போல் மெல்லச் செய்து பயனடைவார் சக்தி தொழிலே அனைத்துமெனிற் சார்ந்த நமக்கு சஞ்சலமேன் வித்தைக்கிரவா கணநாதா மேன்மை தொழிலில் பணியனே. The Almighty, I pray the Almighty that He engage me in the biggest mission or in the best mission in the world, and the pious or the bhakti what I have will be making me efficient to do my duties consistently. And since I stay consistent, slowly the efforts are seen like a sapling which it grows at the right time, which it comes out of the soil at the right time. So for this, the God has given immense strength, and we are performing or executing the duties what He has given to us, not what we are selecting. So we as a homeopath have entered here not by chance, but by the chance of the profession, choice of the profession. It has selected us to the profession. So I pray to the Almighty that this session should go well, and also we all homeopaths raise above heights day by day, step by step, and consistently and continually. So this is just a cartoon picture of Dr. Samuel Hahnemann's tome, in which there is an inscribed called non inutilis vixen, meaning I have not lived in vain. So I pray the Almighty that whoever homeopath is practicing, let their life not be in vain. We continuously perform the duty or the passion on homeopathy and serve the humanity to the best of our possibilities. So 1 minute prayer for Hahnemann. So he, being the great master who has given a big system where he has contributed a lot to the system of medicine actually. So just a few words about what he has contributed to the medical world actually. He is a critical thinker and a very keen observer, and has dedicated his entire life for this system of medicine. We can't even say it is only homeopathy. He has contributed many things for the entire medical world actually. He has a very good insight, very foreseeing capacity, so that he has done like 200 years before, like what we are seeing, we are trying to prove scientifically yet. So we, after 200 years also, his teachings or preachings are relevant, and we are trying able to give a scientific background for those. Like 10-20 years before, we were tentative about how the medicines work, how the potentization works and all that. But today we are able to give an interpretation, scientific explanation for those things at least at the nascent stage, if not to the core. Maybe another 20-30 years, we will get to know more about what he has done for this humanity. So his contributions, mainly it is organon of medicine. I think almost 70-80 aphorisms he has given about how the medical world should be, or the practicing physician, what he should do, how he should do, how they should treat the patient, what all knowledge they should acquire, and how they have to implement the knowledge which they have gained in the medical school. This he has clearly given in organon of medicine. He never said that organon of homeopathy. He clearly stated it is organon of medicine. So this 70 or 80 aphorisms, I think if the whole medical world takes up, or at least give a glance of what he said, try to understand at least minimal 20-30%, they will do more good to the humanity, because it still is relevant to what we are doing in medicine. So he has given a detailed description about art of case taking, and he says that case taking is an art, and practice is an art as well as a science. So he has already given a base for everything. So then we have the drug proving in healthy human beings. In any system, we have not seen that there is a proving done in healthy human beings. They do it in animals. They just do the clinical trials, and whatever data they have to make, they will just interpret the data. So there is a small chance of manipulation of the data also. Possibility is there, but with all due respect, whatever they are doing scientifically under data science, I am not going to comment or say against that, but possibility is there. And as I said, each system has its own philosophy and a background how it works. So when we say dynamization and drug proving and individualization and symptom similarity, this, if you are going to put in a data, and if you are going to extrapolate the data, it might be fruitful, it might not be fruitful, because as we are Indians, we have a lot of regional languages. So as you know, each language has got its own grammar, and if you want to approach every language with the grammar of English, it may not be correct. So in the same way, every system of medicine has got its own background and its way of working in the human beings. Then we are going to, if we are going to put a single theory on that, and if you want to extrapolate the data, it may not be successful. So our data and interpretation require a grammar change. Like how we have a grammar change in for different languages, or an approach for grammar for different languages. This also requires a change in approaching the data and interpretation of the data. Now, this requires a lot of improvement, and there is a good scope also in this region. So instead of we being homeopaths always blaming the data and data games, let us put ourselves like this. We have to find a way to interpret the data, and we have to find a grammar how to fit in the data and prove the scientific world like how it is working. So now I think it's better than before, but still we need a lot scope of improvement in this area. Then his contribution is the potentization, drug dynamization. So when you say drug potentization, it is going to even beyond the Avogadro number. And now we are talking about nanomedicine. From 2000, I think a lot of research has been pumped in regarding nanomedicine and quantum physics. So just we could not even imagine long back, like 200 years before, how Dr. Hahnemann imagined all these things, or how he could get the insight, or how he got the intuition of fixing this just by observing the patients. So how good observer he is, how keen he was to find out that the material doses are bringing in the side effects. And he fixed that by potentizing, by trial and error. Then he approached the patients with that. And one fine day, he has given the potentization drug dynamization theory with all efforts he has pumped in only through observation. He never had a scientific background for that to to see in the microscope or in the nano level scope and then say like this is happening. But he could see the results, and he has recorded the results, and with all due evidence only he has given the potentization theory for homeopathy. And he has coined the terms like allopathy, antipathy, isopathy. So this is still available. Even now we call the system modern medicine as allopathy. So how it works, on the basis of the background how it works, he coined the terms allopathy, antipathy. He has a reason for coining the names, and today also it is relevant. And he gave about the germ theory. He was telling about contagion. He has worked upon epidemics. He has told like this medicine is working good for this particular epidemic, and he has coined the word genus epidemicus. So how did he do? He has collected a lot of data. Now we are saying about data in computer world. He had no computers, but he had a record book, and he had the like he never had the laziness. As I told, there is no indolence. He has worked maybe all the 24 hours every day. I don't know how he was able to bring the data and coin these words and give a remedy for that, and name that also genus epidemicus in long back, and helped so many people. So that is what he has contributed to humanity and for the entire medical world. Then he has given about individualization. You approach each patient differently, find out what is he and who is having the disease, and treat the person, not the disease. So don't get carried away by the disease diagnosis. See, he himself was a allopathy doctor, and later he got to know like it has got side effects. Then he found a medicine like which can work on like yours like. Then he found out like same medicine will not work for everybody because the subjective symptoms are different. Objective symptoms are different between people who are acquiring the same contagion or the same pathology, but they have different subjective and objective symptoms. So the art of case taking has got a big role in this. And he told like individualize the patient, have an individual approach to each patient, then give a clear-cut medicine according to the basic principles what we have in homeopathy, and apply the remedy, apply your knowledge, then the patient will be definitely cured. So he is defining cure exactly. What is cure, what is not cure, what is suppression, so on. So now in this 21st century, in 2025, we are talking a lot about precision medicine. What is it all about? All these days, even allopathy, they were prescribing medicines only to the weight and height. but they named the disease. They had a lot of things because their philosophy is like that. You treat the disease. So they give medicine for the symptoms, for the disease, for the patient. So it was common for all. They only changed the dosage for the weight and height. Then what happened? Now they themselves are saying precision medicine. So, and previous medicines which they were giving for each and every disease, that is not in market today. But for homeopathy, we had medicines before. We are inventing medicines now also. So this materia medica is growing volumes. But the older ones we have not discarded at all, because the tedious work, what they have done is huge. It is beyond, it is really commendable that with lots of efforts they have done all these things. They have recorded things and they have kept it for us. So we are fortunate to have all the materia medicas in front of us. And he even told like how cure should follow. He coined the word cure, and he said cure should be about downwards, within outwards, major organs to minor organs. So how did he frame it? He has seen the patients like that. And when he is saying cure, it should follow this path. Then only they are at cure. Otherwise, they are in suppression. So he is elaborately explained all these things in Organon of Medicine. Now we are able to give an embryological background, like how the baby has formed and how it is given, like above downwards, like head to tail, and within outwards, all these things, how these organs got grown. So we are able to give a interpretation, scientific explanation for what he told about cure, why it is like that. We are able to relate it now. So see how really he is a Mahan, because that is why he was able to give all this philosophy 200 years ago just by observation, keen observation. It's commendable. Then he has told about double chronic disease, pseudo chronic disease. He has even segregated or categorized the chronic diseases into different things. And how, like he is saying, if you give a medicine, it is getting suppressed. It means, what is suppression? It is going from outside to inside, minor organs to major organs. So see that. And he is saying double chronic disease, it is suspending one disease and the other one is taking over. And once this flow is over, and this takes over again. So it is hidden. Never think that is a cure. So observe the patient. So now we have scientific data, like the previous session doctor told about lab investigation. Now we are able to prove this with the lab investigation. Whatever is available, we can take help of that, and we can interpret like whether we are like proceeding towards good prognosis or bad prognosis. And he has given about toxic effect of drugs and diseases are due to wrong perception of the individual. So he says that psych is the main reason for any disease, whether it is psychosomatic or somatopsychic. See, when the body is under so much of stress, and if the body is about to give, suddenly the patient may develop a mental disease also. So it is somatopsychic. From physical level to it goes to the mind, so that the body is free from the disease, and mentally he is crazy, but his symptoms are reduced, then he's saved and he's back to life. Then we have to treat this person. For him, the logic is reverse. From him, for him, it is from the minor organ to the major organ, but it has saved his life. So body is doing all these gimmicks to save the life, heal the patient, or at least to bring him to life. So our duty is to fix this, to heal the patient from inside and bring the disease from inside to outside and save the patient once for all. Now we are able to give some explanation on the neurotransmitters, how the stress level works and what neurotransmitters are secreted in the brain, and how it is becoming a psychosomatic or a somatopsychic disease. This explanation is very relevant to what his ideas were long before. Then the most and one and only wonderful discovery of Hahnemann is the miasm. So it is not there in any other literature. So he has done he has pumped in a lot of hard work to bring about miasms. And now we are able to see the results by fixing the miasm. We get to know like how the suppression works, why we are saying it is going from psoric to syphilitic level. It is danger. What we have to do, reverse the miasm, then only we can claim that it is a cure. So these are the wonderful, wonderful contributions of Dr. Hahnemann. If we list it, we have plenty more. So I just gave the major ones, and I just wanted to give him a big salute for whatever he has done to the field of homeopathy and the medical world, actually. So this was a cute picture. So this is the physician. So our first aphorism, which says the physician's high and only mission is to restore the sick to cure, as it is termed. Like when he was in his deathbed, um, I happened to see a life history of Hahnemann, in which he has mentioned like, see, after his birthday on April 10th, after 2 to 3 weeks of that, he fell sick and he was treating himself. Then later he took his help of his wife and daughter for treat himself. And at the last minute, last like few days before or few hours before, he told, I am not becoming ill, I am dying. So this is one big statement, what I have seen in his life history. It's like, it is mind blowing. A person saying that he's dying, he's leaving the earth, but he's not ill. How confident are we now, like in this polluted, like mind polluted and physical polluted world? Could we even imagine that we will not get sick and leave the world? But for we'll get sick and leave the world, we don't know. So this is Dr. Hahnemann. A big salute for him. So what is he really, by all these things, what is he giving insight to us? What is he telling us? So I like with all the satsang, wherever we go, whatever they say, whatever we have pumped in our mind, whatever I could interpret to my um, very few knowledge, basic knowledge, I have tried to put in this way. Like we should get rid of indolence, that is absolute no laziness. Inhibitions, move towards integration and individual methods. So we have a lot of inhibitions. For me, initially, I was like, no allopathy. If they have hormonal problems, don't take these pills, that pills, don't go for a MRI. And sometimes even I had inhibitions like, if I send for reports, they will not turn up. So I will lose the patient. All these things were there in my mind. But later, like in the last few years, what I have got to know is, if you are able to sit and discuss with the patient and tell him and make him understand, like if these reports are important for these reasons, and when they bring the report, when we are able to show the prognosis, it is actually giving a betterment for our practice. Not, we are not losing the patients actually. And when I am not inhibiting myself to stop the other medicines, so if I am not very rigid on all those points, then probably I'm helping the patient to find the hope in homeopathy. Try this method. When I am assessing the prognosis, and I'm saying all these years you have suffered, never it has gone down, now it has gone down, now you can taper those medicines, they are getting convinced. So now I have started shedding the inhibition in myself. So he has given an insight to get rid of the inhibitions individually as homeopaths. What we have earlier, like when I was out of college, I was thinking acutes are very difficult to manage. But when I went to Kerala, when I was under Dr. KV John, Dr. Ravindranath sir, and Dr. Bhagilakshmi ma'am, I was like, each had an individual method of practice, and each had individual approach to different patients, but they followed only rigidly on homeopathy, but they were all succeeding. Why? Because they were consistently showing up for homeopathy. They are doing the hard work behind it. They also have a data, mental data, and also they have kept in papers, and they keep referring things, and they ended up in these type of practices. So I got to know, I was very fortunate to work on under all these people, and I got to know acute also we can treat. even the life threatening diseases we can treat, terminally ill patients we can give good results. All these things I learned from various legends, legendary homeopaths. So now after long time, like being with them, and after my own practice, now I am getting to know, like I have shed some of the inhibitions. Now this integrative approach is easy to convince all the millennials and Gen Z people. It is very difficult in this chat GPT world to make them understand and make them believe that this is a big system and it is going to help them. That is like, it will not work out. So we have to speak more scientifically and we have to give evidences. It takes a lot of time. It takes a lot of energy. It takes a lot of reading to explain them what they require, and put them across to them and convince them and bring them. And slowly they are building faith on homeopathy. So insufficiency. So this is what I told. Like we know homeopathy, we have studied something in college, then we are working under some doctors, and we are getting to know some of the things, and we are trying to pump in whatever we have learned. But whatever we have not learned, so every day is a learning exercise. So that is why we have to shed the laziness first. Then we have to work on the insufficiencies. When we work on the insufficiencies, when we are able to convince the millennials and the Gen Zs, then only we will be able to counter them and keep them, build the faith on homeopathy and retain them under homeopathy. And by, as a side effect, we will gain wealth also. So, or at least we will have the satisfaction on something we are doing service to the humanity. Then fight against injustice. So whatever somebody is throwing stone on homeopathy, it is little difficult to bear it. But we just walk out silently without saying anything. But we as homeopaths together should fight for injustice. And I'm very happy that IFPH is doing a commendable job by going to reach 1800th day of this international webinars. So they are really fighting against injustice. And many doctors, many leaders in this IFPH forum, they are doing many things for homeopathy. So which is commendable. And each one of us, in whatever way it is possible, we should come forward. But as myself, I know my limitations, and many will have limitations, but still try whatever small step or squirrel step we can contribute to the system, so that the system survives and more betterment for humanity. But how we say, like whenever the nature is going down or it is getting polluted, the ozone layer is polluted, all those things, but slowly it will find its own way to recoup and come up. Likewise, homeopathy, you can't make it disappear, that is for sure. It will come up. But as homeopaths, it is our duty also to contribute something, whatever possible way we could, and try to push little bit upper. See, by saying that myself, I could understand the limitations, but still I want to work harder. At least in future I should do something. These plans are always there in my mind. So for everybody, this should be our goal. Then fight the ignorance. This ignorance is amongst the people who are getting treated, and it is amongst the homeopaths also. We believe only in particular potencies, particular approach, and we never try to combat the ignorance of the patients who come to us. This we have to fight. See, if we don't fight against the ignorance of the patient, we will lose the patient. And if we don't build them the hope, they will not stick to the system. So it's a loss for the system than to us. So I think we should fight against the ignorance. So what should be our approach? Then, as there are forums like IFPH, we should be associated with the satsangs. Like for bhakti, how we say we have to like be with the satsang, so that our mind is always filled about pious thoughts or religious thoughts about God. I will say not even pious thoughts, religious thoughts. I will say um, divine thoughts. It should be there for everybody. Otherwise, our mind will poison, and we will be ready for any type of immoral things. So, likewise, in order to be hopeful of being a homeopath, we should associate with leaders who practice well, and always be ready to gain knowledge when they share their stories. There may be success stories, there may be difficult stories, there may be failure stories also. Every story gives us an experience. So we may not have the age for gaining that experience. We have to build it further. So we have to take it. It can be easily taken from the pioneers who are before us and forward to the next generation. This is a possibility to associate us with the legends, and also associate with the help groups or schools and other social places, so that you go and preach, or at least give some insights about what is homeopathy, what is alternative system, what is Ayush. See, Ayush itself has got a lot of relevant and very basic and very good things for not getting sick, first of all, and getting cured from the diseases. It is not only the allopathic system which is existing. We have a wide range of medical systems, and we can pick and choose according to the nature of us, and also the best fit. We can select the best fit medicine for us, and we can use it, and can be profited out of that. So associate with the schools especially. So why did the government put the Swachha Bharat Abhiyan in schools? Because they want the next generation to bring that sanitation, and to know about the importance of healthy environment. So that is why they brought this program in schools first, and in all villages. So in whatever way it is possible for us, we can go and give them insights about Ayush systems or homeopathy, wherever, whichever is our strength, and we can definitely sow the seed inside the minds of the younger children. So tomorrow they have a faith. They know that there is plenty available in this world, and they can approach a homeopathy or Ayush system and gain good health because of that, and live a healthy living, and try to modify their lifestyle so that they have a better future. So we should always work towards to the younger citizens, so that they give better tomorrow for the nation and for the world. So consistency, sure. See, whether you fail or you succeed, with the number of patients coming or not coming, not showing up, whether you are giving tests and they are not turning up, make it a practice. Try to convince them, talk to them, whatever possible way. Try to make them understand, make yourself skillful, and be consistent in the show up, so that definitely tomorrow success is there. So if you don't pump in the hard work today, tomorrow the success is not a possibility. And I don't think we like every homeopath is very skilled like Hahnemann, who has a keen observation and a lot of insights and critical thinking nature. No, it should be developed in due course. That can come only through hard work, only through consistency. So analyze all our cases without any laziness. Put the effort to understand why it ended up in cure and why it is not ending up in cure. Then this retrospective analysis will help you to make you understand what approach should you take to the next individual who is approaching us. So this is very, very important. So this is what we have to do as fellow homeopaths. This is for the system, and this is for Dr. Hahnemann. So what next? So recently I have read this book called Homo sapiens, and I've seen these 3 lines in the book, which got retained in my mind. Imagine order is embedded in the material world. Imagine order shapes our desires, and imagine order is intersubjective. So what is this? So many concepts, be it feminism, be it equality, like in voting rights, in equality. So we had a patriarchal society. There, like it was always the father and the men who was ruling, but slowly as time went faded away, now we have a narration that equality. is important. So every human is equal. We can't discriminate an individual because of his wealth, or because of his status, or because of his position, or because of his caste, creed, color, or gender. So this, how this narration was brought up. Earlier something was existing, now it is totally different, totally opposite, we should say. So these narrations are embedded, some narrations are already embedded, then that will shape our desires. For example, now we say depression shopping. How this word itself get coined? Because this is all slowly, the consumerism is being brought up to the lowest level. The meta is conquering the world, and what they are doing, they say they keep giving gyan, they are giving the inputs like every day through ads and through social media, that this is how you have to do, that is how this is happening, this is what it is. So we are ready to take it, and so we develop, okay, I am depressed, I should eat well, I should get chips packet, I should get all like foods from outside, and I will eat at whatever time, like night 2 a.m. biryani, 2 a.m. social media, 2 a.m. show up, all these things. How did this narration got built up until 2000 or 1990s? I never know all these things, late night outs and all those things. How this narration built up through social media? Why did it build up? All the consumerism to make the customer buy their products has been slowly narrated, and now in the society, so they are waking up till 2 o'clock and they are doing all things whatever they want. It has ruined our lifestyle altogether. How this narration came? Then it becomes, see, why if only one person thinks that will it be a possibility? It is not a possibility at all. So it slowly built up to the entire society, and all are following this. Now Gen Z, millennials, you can't stop them from all these things. Now a child is born with a mobile phone. The child knows how to operate it, how to do this and that. Maybe the elder parents doesn't know, the grandparents doesn't even know what is it, and we are sandwiched between the known people and the unknown people. We don't know. So we are in a virtual world. How did we end up? Because it became an intersubjective. Everybody started speaking about that. Then this is a new norm. So we all follow that. If we don't follow, we think ourselves we are not get identified with the society what is existing. So this intersubjective narration is what is the immediate need of homeopathy. So we have to build up this intersubjective narration that there is Ayush system, there is homeopathy. It can do good. It can do good as preventive. It can do good as a curative. It can do good as a palliative. We have to give all the evidences, convincing the patients and the society. We have to build up this narrative in the society, especially in the schools and younger people or the graduates who are fresh out of college, so that this becomes an intersubjective narrative, and this becomes a boom for homeopathy. This is all like, it's a dream. It's like how I think it should be. Well, is there a possibility? Yes, is there? It is a possibility. Many homeopaths are there in social media. They are doing a lot of posts in the social media. They are writing a lot of things in the media, and people are slowly getting aware. But it is a difficult task because it cannot happen in a single day. So now I have just 3 cases where I have taken the integrative approach of other medical systems, and how I see this is nowhere related from the introduction what I spoke about, but that integrative medicine and individuality, this is really going to help us in building the narrative. So that is why I took these 3 cases. Whether it is challenging, I don't know. The forum is full of experts, but I just wanted to share my experience. This is case 1. This auntie, she is like 78, 80 years old almost, and she is having vitiligo in forehead and shin bone in both legs. She's very loquacious, and whenever she comes, she'll complain. And this she does complaining with a great smile. She'll laugh and tell, like, I have these symptoms. I'll never think like she's really suffering. she's so much suffering that how she is able to narrate all these symptoms with this laughing or smiling mode. I was always surprised on that. But and she had knee pains, and it is always alternating and all that, but left side is more. Anxiety about health is there, and she is very hasty in her speech. She has a fast pace, and she cannot rest if things are not in order. She is already 80, but she is very busy at her home. She is doing her household chores every day, and she is busy, and she is under Ayurvedic treatment for knee pain. Somebody her known to us, they have referred me, and she has approached me. So now I saw the vitiligo. I didn't give much importance because it's only a skin thing. I don't want to give much importance, and I didn't think that it is going to help her or it is going to cure. But I was worried about the knee pains. But I started giving medicines. 1 year gone, she just told, like, I am under Ayurvedic treatment, I will go, I am getting better results there, I'll come back later. And she left. After some time she was not there. Then she came back to again me after some time, and she told, parallelly with Ayurvedic treatment, I will again go with homeopathy. I asked, what happened, auntie? Then she was telling, like, my knee pains are not better. My sister has undergone a knee replacement surgery, and I am afraid, like, at this age, should I have to go for the knee replacement surgery? Now she has come to me with all these symptoms. Like, is there any guesses for a remedy for this condition, for this outline? Okay, so I couldn't check the chat box. 1 minute. Natramure. Okay, there is one medicine, Natramure, which has come. Okay, but to my surprise, I gave importance to this lamenting with smiling, and I just checked the vitiligo and also the knee pains. Um, but the specific remedy for vitiligo, it turned up to be the medicine. It's covering the lamenting, bemoaning, wailing, alternating with laughing. So, and then there is a laughing with lamenting, that rubric is also there. And this arsal flavors was the medicine in that. And vitiligo, it is covering arsal flavors. I think arsenicum has got this anxiety about health. Rest cannot if things are not in order. And she's very anxious that, like, her sister is not well. So whether she may need to go for the surgery. And I was very tentative by giving this medicine because it turned out to be a specific and a very low grading medicine. So I thought, like, whether it will work or not work. I thought I will change the prescription later, but to my surprise, this medicine worked very well, and her patches are disappearing from above to downwards, and that is a syphilitic symptom. And her knee pains are slowly better, but not better than vitiligo. When we compare the vitiligo, it is better than the knee pains. So I think syphilitic is reducing, and psychotic, the knee pains are still there. So I think arsenic salt flavors will go for some time. Then later we need to see, like, what her constitution may be, or this medicine itself is just taking care of the knee pains. Because when I saw the literature, our self flavors is covering the knee pains, which is alternating. So she has that symptom also. So Natramure is a good suggestion, sir. I will keep in mind. If the knee pains are not better after the vitiligo, I'll definitely think about the Natramure prescription as well. Then case 2. So this is the auntie's husband. He has paralysis of right side. He had history. He's been treated with allopathy, and he was some village officer or something. And he was too empathetic and too generous, and he was against the bribing and all that. He is very anxious about the wife's health and his health, mostly about his wife's health, to the health about others and his children. And he's little bit slow. I'll not say he's lazy, but he is very slow. Patient is on allopathic medication, and the history is like he had a high BP suddenly. Until then, when he was with paralysis, he never had BP. He is 82 plus, but he's walking now. He was under allopathic treatment and also under allopathic treatment, and he is on a regular physiotherapy, and he is very diligently doing yoga at this age, 82. It was very surprising. So this patient accompanied after a long time, after repeated asking, one day with this auntie, and he just told, I am under allopathy. I don't have trust in homeopathy, but still, if you say that I should take, then I will try for some time. Like that, he told. Then the amount of defiance what he had, I thought like I should select a medicine which is covering that attitude, and I wanted to give a medicine. So I repertorized this case, and this case paralysis, right? This was a very local, specific, particular symptom, and I took the sympathetic, compassionate too, and I got causticum. So I just saw the entire whole history, and I thought this medicine is suiting, and he is defiant and he want to stick with allopathy. No, I can't taper or ask him to withdraw this allopathic medicine at all. If I make this statement, definitely this patient will lose hope with the homeopathy and will never turn up. So I was not rigid with my approach, and I was ready to give the integrative approach to this patient. And he is already 82. I don't know how more good I can do to this patient, but he is walking and he is okay. He is doing his daily routine. So I don't want to disturb the patient. So I gave Vasticum, single dose, and is far better. So, but still, I have not withdrawn any of his medicines. He is taking one medicine for BP and one more medicine for I think blood thinners or something. What they have given, and he's continuing that, but he's diligently following yoga at this age. I don't know what postures he is able to make because of the paralysis and other things. Definitely, he would have got some limitations, but he's trying. So I encouraged him doing that, and I have given this medicine. I appreciated the auntie for giving full support for this uncle. So this is one beautiful case. Then I had a case of like I think the child is 6 year old and he has adenoids. They came with a CT report, and he is under allopathic treatment, and every month every change of season, every allergy is provoking for this child, and he gets cold, coryza, cough, fever, everything, and they go for allopathic treatment. They take injections, and he has a bleeding nose. So I thought it is epistaxis, and I initially treated these fevers and epistaxis, all those things with belladonna, but it will reduce, but it will recur. The frequency never reduced, and this patient was like that. Then I tried, I thought like dry coryza and a lot of crust in the nose. Then I thought arum triphyllum. But it helped in acute, but the frequency or other things intensity never reduced. So this child is constipated. Now I repertorize the case. Discharged crust, caps, detached bleeding from, and easily. But if pulled away too soon, give soreness at root of the nose. So I have seen that marks in the nose. Then there is calibec in these two things, and in constipation, children in that also has got calibec, and he is a very restless kid. Mm, so with all these generals, I have given Calibike. And after Calibike, this bleeding tendency, the dry casts are forming, but this bleeding tendency and the frequency of colds has come definitely less. And like almost in the last 3 months, he never had a cold and not even a single episode of bleeding. And now I have not repeated Bri, Bell, or Arum Triphyllum, anything for this case. But like now, monsoon is up here. Now I have to give a follow up, like how he responds to the Scalibake further, because I have given only a single dose. I'm just watching and observing, giving the time for the child to throw up symptoms, or to completely get all right. I'm not sure, but I'm always hopeful. So this is the end of my session. Thank you for the patient listening, and I think I have done some justice to this time, whatever IFPH has given to me. I'm very thankful to the forum. Shall I stop sharing, sir? If anybody has any questions, or if somebody wants to share some, share their insights, they can share.
Yes, definitely. We should share. That is some policy. That's my policy. Definitely, it's a wonderful talk. I think it once again revealed your capacity to think. As rightly mentioned by Dr. Samuel Hahnemann, thinking is the most difficult task under the sun. But anyway, you succeeded, and you suggested about the build a narrative in the society. That's the most the crux of the topic, I think. What is desperate in this is narration. We all know the less effective, half effective medicines were narrated beautifully, and they got the results. In case of this money, as wealth is an important fact. So that's the most important thing. Each and every homeopathy students and teachers, as well as the homeopathic lovers, should attempt in that way. Then you mentioned about the limitation. I think the limitation is our limitation, the limitation of brain, because the human brain cannot bear all these things. Because in the syllabus we study almost all things, the general medicine plus homeopathy. That is beyond all these things. So it's only limited our limitation, the limitation of brain. Then you mentioned about the organ of medicine, the potentization, then contagion. These are very beautiful things narrated. Then again the individualization. Now the modern medicine is also brings things, but they never accept that term. They christened it as the personalized medicine, tailoring the case. Again, there's enough narrative there. But what it is, we are the real owners of this individualization. Then the psychosomatic, the recently said the mind-gut axis. Everybody is talking about this mind-gut axis, but we are talking for more than 250 years. There also the lack of narrative is a problem. So we should develop that. That's a very important aspect of suggestion by you. Congratulations. Thank you.
Thank you. Thank you, sir.
Yes, Dr. Veena, it's really an excellent session. And as Dr. Manoj narrated, it's really, your thoughts are running very high. That's why you are able to find something in between the lines in an organ of medicine. And that really stuck on your mind. And definitely, we used to get patients from patients who are taking Ayurveda, as well as allopathic medicines when they come to us, and sometimes we may not be able to stop all of it. The patient may not be willing to stop these things all of a sudden, but and sometimes they may continue even without our knowledge. They may continue the Ayurvedic medicine along with homeopathic medicine, but still we get result. But as and when the patient is feeling much better, then she gradually avoids Ayurveda or allopathy, even without our suggestion, because they are pretending that I am not taking any Ayurvedic medicine or allopathic medicine, but they may be taking without our knowledge. And that also that is a big dilemma for us. But when they get the real benefit out of our treatment, naturally they may stop within short time from the other system they follow. And homeopathic system is entirely different. And today morning, I got a patient who has visited so many doctors for her problems. Particularly, she has a severe numbness of legs, and severe abdominal soreness and backache and always. And she told me that, doctor, I have visited so many doctors and so many physicians, and they used to take the case in laboratory findings, and they gave me so lot of medicine, but still I am suffering from the same disease. We have a talk of about a half an hour case taking. And after case taking, I told her that, oh, you looks very pale and you are having very anemic. You need to take, then what kind of food you used to take? Oh, doctor, I'm very much interested in non-vegetarian food. I'm not taking any vegetable diet. I don't. I just educated her that you need this kind of vegetable and fruit, because that things will give you a maximum amount of hemoglobin. So once your hemoglobin level is corrected, naturally you will be feeling better, and you even though you are just 62, I am 65, about to reach 65, and you can see the difference between you and me. Then what she told me that, oh, your doctor, you looks like 40 to 45, and I told that you looks 75. Oh, yeah, exactly, doctor. People used to ask me, why, doctor, this is happening. Oh, I told that, no kind of this thing, no kind of the so-called vitamin tonic can bring you back to your health. But instead, you just take a glass of milk, an egg a day, as well as a lot of vegetable. That will definitely give your face a bright, much younger look than what you looks now. She was really happy, and she told me that I will come with my daughter. She's a professor working in a college. I will bring her to your clinic. So this is what what the basic difference between homeopathy and the other system of medicine. So that's what I would like to add to this session. Anyway, you really need appreciation from all the people here. What a magnificent presentation, I must say. I am inviting Dr. Ramray sir for a session. Comment. Okay.
Thank you so much, sir, for your kind
Thank
words.
you, Dr. Daneshji and Dr. Manoj, sir. Congratulations, Dr. Veena Madam. Very
Thank you,
nice
sir.
presentation, excellent session, very good. Describe the handman, great handman thinker, or handman integrative medicine, or individualization. So homeopathic is the individualization pathy, and treat the patient, not the disease. Homeopathic medical science, there are three fundamental laws: gently, rapidly, and permanently. Permanently means curative way of treatment, not palliative way of treatment. And when they have palliative way of treatment, no suppression. Homeopathic is the no suppression. Homeopathic is the gently, rapidly, and permanently. So very nice presentation and case, very good case, vitiligo and paralysis. So very thanks, Dr. Veena Madam. Thank you.
Thank you, sir. Thank you for the entire forum. Thank you for IFPH for giving me the opportunity again and again. I'm so thankful.
Yes, thank you, Dr. Ambaresh sir, and thank you, Dr. Veena, for such an excellent session. We definitely need you back for some more presentation, because this kind of presentation really thrills us. And not only the homeopathic doctors, but also the homeopathy lovers too. And yes, so Dr. Ruja, you didn't open your video. That's why we couldn't call you. Anyway, always come with your video before the closure of the time. That's what we are looking at. Anyway, tomorrow we will have a session from Dr. You or Mama, and Doctor will be talking about importance of follow-up in homeopathy practice. So another big session is waiting for you tomorrow. Hope all of you will join us tomorrow at the same time. Thank you all. Good night. Okay.